we welcome our next speaker, Mr. Johan van de Gronden. Since 2018, he is the Chief Executive Officer of the Dutch Cancer Society. Graduated in the humanities, philosophy, and with, I know, a very broad interest package, professional experience and vision, not only in human nature. You were right, Johan, we did not meet yet in person, but exactly 2 years ago, during the Symposium of the 30 years of cancer registration in the Netherlands, you gave an inspiring lecture, Living with and After Cancer. But I was hidden in the public. I was already preparing this meeting. We had a global view on cancer control. Europe has a beating cancer plan, and I think that you have an important partnership and vision to introduce for the Dutch cancer agenda. So please, may I offer the floor to you for your presentation. Thank you, Johan.
Ladies and gentlemen, good afternoon. It's an enormous pleasure and honor to be with you here tonight. First, a confession to make. At my dinner table, my daughters call me a boomer. You know, I don't know if I am a boomer. Actually, I would be a very late boomer, but they somehow enjoy the expression, and then I have to explain my behavior. Well, I think my dear colleague Valerie has referred to this boomer generation because actually it will play quite a big role in my presentation tonight, so I feel very much involved in the very topic I want to share with you. Now, when I drove up here to this studio to address you tonight, I was just thinking, when do I assume that my talk is a success? Well, let me mention to you a few very simple things. If you go home tonight or log out of the live stream and you think that this talk was, one, urgent, second, a no-brainer, and third, something to get your hands on tomorrow, it'll be a success. So the next 15 minutes or so, I would like to take you on a journey for a Dutch cancer plan. These cancer plans are also known as cancer control plans. It's already been quite a while that the WHO passed a resolution actually recommending countries to, if they want to make an impact on cancer control in their countries, to start writing a cancer control plan, a comprehensive one. We did so in the past, but unfortunately our current one is expired. It has expired quite some time ago, and we are without a comprehensive cancer plan currently in the Netherlands. I am ashamed to say so, and I'll make the case that we need to build one. You have already learned from Valerie, and actually I'm very grateful to the previous speakers, both Elisabeth and Valerie, to light the burning platform here tonight, because obviously you have been, or will have been, if not shocked, at least surprised by the incidents and the tsunami that's coming our way. So 1 in 3 people in the Netherlands will be confronted with a diagnosis, and they haven't told us man, it probably will be 1 in 2. And these cases now stand at 150,000 a year. They will rise to 165,000 by 2030. And almost 50% of these cases are people younger than 69 years. So we have already 800,000 people living with or after cancer today in the Netherlands, and we will pass the 1 million bracket by 2030. And this is an optimistic figure. I've also seen calculations of epidemiologists who say this might actually be closer to a figure of 1.4 million on a population of 17 million. This is a major burden and a silent pandemic that's taking place. So 45,000 new diagnoses per day currently, and as I told you, relatively young people being affected. So you understand that many of you are actually working in this field. The demand for care in these welfare services is increasing, and it's already significant. We're currently in another pandemic, and we know that the critical cancer care is at risk as we speak, even in such a high developed, very, very rich country like the Netherlands. And as the number of cases is rising, at best the number of employees in the healthcare system will remain the same. So it will put a lot of pressure, and the healthcare cost as in many European countries, are rising faster than the growth of our GDP. So we need to do something here. It's quite simple. Joining forces in an integrated approach is necessary to tackle those complex challenges. Elizabeth referred to human nature at the beginning of this talk. Well, humans tend to get together, but to have them cooperate is a different ballgame. It needs a little bit of nudging and a little bit of coordination. Now, those of you who are not familiar with the Dutch language might think, my goodness, what is this? I am confused. And I can tell you that if you're a native Dutch speaker, you also think this is spaghetti. But this is actually the field of people, organizations, foundations, charities working in the field of cancer control as we speak. So there are a number of national initiatives. There is a national initiative to combat skin cancer. There is a national survivor task force initiative. There are many plan makers. There's obviously a ministry out there, if not more departments involved. There are research agendas. There is an EU beating cancer plan. There's an EU horizon on the context. But how does it all come together? It doesn't come naturally. It needs focus. It needs coordination. So the way we plan to do this is actually quite simple. All good plans are quite simple. We look at the patient journey and have actually 4 angles here. So it's prevention and early detection, diagnosis, treatment and follow-up, living with and after cancer, so the quality of life, and then slightly different from the EU Beating Cancer Plan, and I think Elizabeth has referred to it in a previous talk 2 years ago, also palliative care. The Dutch Cancer Society has for quite a while, if not neglected, has spent insufficient attention towards the very important topic of palliative care, and we think that this needs to be included in a comprehensive cancer plan. So you can zoom in. You can take, for example, the EU Beating Cancer Plan and map this on this approach and see where it overlaps, where you find a gap, the palliative care, and where, for example, on prevention and early detection, you see a lot of overlap. And then this needs to be coordinated. And there are sort of 4 pillars underneath: on research, on organization and quality of care, on data, as we are with the National Cancer Registry here tonight, obviously, and it needs to be funded. I can say with some pride that the Dutch Cancer Society has actually grown to become one of the primary sources and main sources of private funding of cancer research, both base research and applied research, clinical research in the Netherlands over the past decades. We've been around for 70 years. But I should also add that we do not exactly know how the surroundings look like. So it's great to be a great player, but it's even much better if you have a good understanding of the alternative sources of funding and on the complementarity of the whole scene, including the sources that might be available at the EU level. So we want to have a plan, and again, the slide itself is Dutch, but you don't have to look at that at the moment. It's just that we want clear, smart, measurable, and ambitious goals on the 4 to 5 pillars I have just mentioned. And we've actually set the scene. We have identified all the potential, both the low-hanging fruit and the middle to long-term objectives. And I'll get back to the main objectives later on in my brief talk. So what would be the added value of a coordinated effort of such a cancer control plan? Obviously, to reduce the impact of cancer by joining efforts in an integrated long-term approach, by describing a clear means of achieving your goals, by making them measurable, obviously also to limit the cancer burden by trying to be much more effective in the prevention. We need to prevent more cases because otherwise we will be swamped with cases in terms of care and cure. And we need to accelerate early detection, diagnosis, and better treatment. I say this within a context that within the framework of our own ministry, there is a tendency to frame cancer as a chronic disease. And I take great exception at that. Cancer is not a chronic disease. It is not even close to a chronic disease. If 45,000 citizens are dying every year, if the 5-year survival rate stands at 65%, we cannot yet be talking of a chronic disease. We still need to treat cancer in a curative fashion, and we need to deal with it urgently to prevent, to better treat. And as you've seen, Valerie has also pinched a little bit the dreams of yours who still thought that the Dutchies were at the top of the pyramid when it comes to effective care or even incidence, and at best we are somewhere in the middle range. And we don't like to be in the middle range. We should be wanting to be on top of that very pyramid. So the starting points you have been able to read on this slide, I won't dwell on it for too long. Our ambition is to be ready and get it signed in 2022. That's next year. We have been a little bit hampered by the curious case of Dutch democracy with a caretaker cabinet that's been taking care for almost a year now. We are desperate for a cabinet that's actually in full charge, for a minister of healthcare who has the mandate of our parliament and of the citizenry of the Netherlands to actually tackle this very problem. And we know, and that's a very good encouragement, that almost the 150 parliamentarians in our system have voted in favor of drafting such a cancer control plan or agenda together with the Dutch Cancer Society. Unfortunately, the caretaker cabinet or the caretaker minister for health has deferred it to his or her successor, and we hope that he or she will actually take on his or her seat by Christmas. Because I'm a little ashamed to say that the initiative for such a plan comes from a charity, the Dutch Cancer Society, from the Patient Federation, and from the Cancer Registry, our host tonight. This is also a bit of an exception to a rule in Europe, because in many countries it's actually the government taking that initiative, and we have to work hard to get the government on board. So the overall target would be that the plan contributes to a significant reduction of the impact of cancer of patients and society in 2030, with fewer people with cancer due to healthy lifestyles and the living environment. You've heard from Valerie earlier tonight that quite a number of our incidence cases are related to an unhealthy lifestyle, maybe too sunny and too affluent in the Netherlands, and we can deal with that. We want to increase the 5-year survival from 65 to 75%, obviously with a good quality of life. My friends from Cancer Research UK have a wonderful sort of marketing phrase which may be easier to remember. 3 out of 4 in 2034. I love that phrase, but I'd like to have 3 out of 4 in 2030, even if it doesn't rhyme. And then an optimal quality of life for patients and their relatives. Because as you imagine, also in the informal healthcare system, the recruitment and the training of volunteers, we need to see system change, not incremental change, but system change to deal with the tsunami that's coming our way. So, the time is, I hope, now and not tomorrow. We want to work together towards a resilient health system, and we know, and many of you know, and we actually experience it from day to day, the way that we have organized our health system currently cannot deal with the type of health hazards that are part and parcel of the 21st century. We need to rethink our health system. We need to rethink how we deal with pandemics, and we need to rethink to what extent so that the low cost, the bottom line, the efficiency phrases actually are still applicable to a good healthcare system. With the number of intensive care beds currently in the Netherlands among the lowest per capita in the European Union, and I'm not proud of it, and we should change it. As a matter of fact, I think I am almost at the end of my talk. Just one word on the project approach. We propose a very simple organization with an independent chairperson, a small project office, and then a number of working areas underneath. We are negotiating with an independent chair currently and hope to have him or her appointed very quickly. And I'd like to remind you of similar cases like how do you deal with a climate crisis? Well, actually by organizing a national plan, by inviting all stakeholders to the table and to make sure that you come with a plan that actually allows for synergy to happen. That's exactly what we need to do in the case of cancer care and prevention. So the next steps I have here, we're more or less at the early end of this arrow, but we hope that we can speed this up very early in 2022 because we have no time to lose, and we hope that all of you will help and participate. Finally, and then the floor is yours for another 5 minutes for any questions you might have. Obviously, we would need a good dashboard so that we can actually monitor progress against measurable targets over time, on target, on budget. Thank you very much.
Thank you very much, Johan. In a nutshell, but what a kind of project you will be tackling with 3 parties. And thank you for joining here at the table. And the question that is really burning, I think, for me, but also for others that are questioning you, how could be the role of the government in this? Because it has been asked so many times that I have to ask you this question. How would you like to see the role here of the government if you have one? This is really not a joke. This is really, how would you like to see that?
Okay, I will try not to be party political, but I may have to say a few politically incorrect things. So I think we're waking up from and the choice is yours, either a neoliberal dream or a nightmare, where thou shalt not have plans. Thou shalt not make plans. Thou shalt not take coordinated control from central government, because it's society and the stakeholders who have to come together, and then the government will play a process role. I think we have learned the hard way in the Netherlands that this does not work. So we need a government with a vision. We have a prime minister who has been on record to say, if you have a vision, you need to visit an ophthalmologist, right? That's what he said. It may be a great joke, but for God's sake, let's get over it. Make a good plan. I need the government, we need the government, full-fledged on board. And it doesn't have to be top-down, from state downwards to sort of lower levels of governance. Well, we need them there in a very engaged fashion.
And not on a short term, on a middle and on a more long term, because how can you tackle the many problems? How will you choose in these many problems your urgencies and your priorities? How will you do that then?
Well, I think the government has a very sort of first primary instinct to help sort of control the cost of a rising healthcare system. And unfortunately, cancer care and treatment, and definitely a number of, well, quite, you might say, expensive or at least costly treatments in the pipeline, will urge them to the table. We have to tackle this in a coordinated fashion with all stakeholders, because otherwise we're running into great trouble.
Mm-hmm. And that's maybe what somebody is saying too. What is your message then to our national leaders, or also maybe for us? If we see cancer cases rising the next 10 years, less employees also in healthcare, and that related to also to the COVID parameters.
It means that we need the brightest brains and the best logistical people and all the stakeholders at the table. We have excellent people all over that map I've shown. I've sort of jokingly called spaghetti. But there are excellent institutes, excellent hospitals, excellent academic hospitals. There's brilliant research in the Netherlands. There are good startups. It's a good sort of business environment. But you need a coordinated plan with all of them to make sure we get from this sort of average, medium performance to the top of the range. And that generally tends to speak to Dutchies. We want to win the World Championship next year in Qatar. even if we would have wanted it to be at a different place. We want to beat the Belgians too. We want to win, the most medals at the Olympic Games. I want to win the cancer control area here in the Netherlands.
And let's get back to the persons that we need to involve. So how can you stimulate a healthier life in combination with all the economic and the politic forces that are now ongoing? For example, also smoking.
Well, there's one thing that government needs to do now, and actually to raise taxes on these cigarettes and tobacco products, right? This is a decision that threatens to be deferred, also because, again, we're a caretaker, don't want to take that decision. We need to take those decisions because there are people's lives involved.
And the persons that we need to motivate. We need to motivate them. So there is an insight of that we have to change some lifestyles.
Of course we need to change lifestyles.
How can we do?
But it's very hard. But we have excellent also behavioral scientists who can help us. We need to campaign, we need to reach out, you need to define target groups. But it means it doesn't happen on itself. No. It doesn't happen spontaneously. We Dutchies, for example, still tend to behave in the sun as if we're Northerners. We need to behave like we're in the Mediterranean. Wear a hat, protect yourself, don't sit in the sun between 12 and 3 in the afternoon on a sunny day. This is strange. Huh? So look at the cancer atlas of Valerie. Yes. You will see that the cancer incidence exactly on the coastal areas where people like to sunbathe is much higher than the other areas of the country. We need to know these things and then provide alternatives. You can lead a very happy and healthy life without burning yourself in the sunshine and look healthy too.
And you have the perfect weapons now. You have the patients, you have the charity and your organization also, and you have the cancer registration and the IKNL, so it should be a success. And
if I'd be in government, I would say this is just a gift. You have all the societal energy and organization. Join us.
Join us. Wonderful message. Thank you so much, Johan. Thank you for this chat.